Thank you for being here and for the invitation. I'm going to share you some of the updates that we have in our national time use survey in Mexico and NUT. Just a little background information. We have a good tradition on time use surveys starting in 1996. But something important that happened was that in 2014, 2019, we have started with the same methodology. We didn't change significantly one survey to the other. And since it was an independent survey, it became what we call it at INEGI in Mexico, information of national interest. So once a survey reaches this category, it becomes not only important for INEGI, but also it becomes it's mandatory for all ministries and people doing policy to use the information that comes from the survey. But also it has priorities in budgeting, which is something important because, for instance, this year we have some budget adjustments, and it was saved from that adjustment. But also every change that we make of the survey, we have to assess the impact of these changes. And it's a long process that we had to follow. And this morning, for me, I know everybody is like in different places. I'm going to share with you all the process that we're following to update information for the new 2024, which we will be collecting by the end of this year. So the news that we have is, as I was telling you, was declared information of national interest in 2002. So in order to update the questionnaire that we have, we don't use diary, we use harmonized we use questions to collect the information to specific activities. We had to open a public consultation last year in May of 2023, essentially to identify new needs for information about time use, but also to harmonize information with the conceptual design to update a lot of the things that we knew we were lagging behind, and essentially to collect all the requirements that we have for every user. After that, in November of the last year, we have these what we call the statistical test. Essentially, we go to the field and we collect information using the questionnaire that we had and the new questionnaire, and essentially assessing the differences in the information that we're collecting. For example, changing the order of the options so people could choose one or the other. So we have to measure the impact that creates that change. And we will be implementing our time use survey in October. We're starting the collection, and hopefully, right now we are analyzing the results from the two questionnaires that we have. So how do we do this public consultation? Essentially, we open a website. At the INEGI's website, we open a section where people can just create an account, essentially just log in and provide their insights and the request for new information. That is open to anyone in not only in the country, but everywhere in the world. But essentially what we usually get are inputs from people in Mexico. But we also have meetings with specialized users. Academia is an important one, but also we have the collegiate bodies that we have in INEGI and the National System of Statistical and Geographic Information. So we have specialized meetings with these specialized groups. We receive lots of requests from organizations, institutions, civil society, essentially asking us to include new topics. And as I was telling you, after the consultation is closed, well, the time that we have to receive all these requests, it's open for a month. Then we start analyzing the viability of these requests, and we end up with a new questionnaire, and that is the questionnaire that we test. So what we have, essentially, just to mention some of the meetings that we had last year. So we have the Specialized Technical Committee on Information with a Gender Perspective, which is an important user of the information that we publish from INUT. So we had a meeting with them. We also had meetings with groups that are taking care of people with disabilities, so essentially to understand what their needs of information were, or probably what they felt that they were not represented in the survey. So we also had a meeting with them from the National University, Colegio de Mexico, and all these groups. So we ended up with 427 contributions, most of those were they essentially asked us to include new questions or to have more answer options in the questionnaire. Uh, the second in relevance was the modification of the question, or sometimes the wording that we had to be more specific. For instance, doing something exclusively or not at the same time that we're doing something else, or get rid of that option. Sometimes it was really interesting to see all the information need that we detected. But also, the third one were some comments on methodological and even capacitation that we have for the people who are collecting the information, probably to make them more aware or to ask them to ask more than one time, probably two times or three times the same thing, so we can get more information about households and activities. Some of the new topics that were asked to be included, that we are actually including, is the use of technology, not only for work, also for studies, the impact of these technologies in the population, teleworking and characteristics of teleworking, migrant population, Afro-descendant population, LGBTQ plus population, also the impact of COVID-19 on care and the cost of this care that had to be provided, and presence of unpaid work provided by other households, not only people in the household providing care to other households, but also to be more specific about people receiving care from somebody who was not living with them. What criteria we follow to evaluate these proposals? Essentially, the information has to be useful to defining public policy or to evaluate public policy related to unpaid work, but with this perspective of making gender gaps visible. That is an important thing for us, but also to be able to create indicators to highlight the gaps in unpaid work following this gender perspective. Also, that information would be useful to the satellite accounts that we have in Mexico. We have two specific accounts, the unpaid work in household, but also health sectors and nonprofit institutions. They use information that we produce by ENUD, but also that has to do with the objectives of the survey and the question that has been proven in some other surveys, or that we know that it's not going to create an issue with the questionnaire that we have. And the most important one, and I think sometimes we don't pay attention to this, is that the new proposal does not have to affect the average interview time, because it is a long survey. So we are really careful to not to extend the time that we spend asking the questions to people, so we know we get better quality in the answers. Some of the main adjustments that we are actually testing, or that we tested and now we are analyzing, was just for instance, to identify specific needs for people, people with specific care needs, but not only for disabilities, but also for illness condition that was temporary. So probably somebody was just sick for a couple of weeks, so that was the impact of that. We are following the Washington group in disabilities, but also to have the option of something that was not permanent, and to identify what's happening in that. Also, the impact of virtual or hybrid occupation and working during the week in Mexico after 2020. I think it was in 2022 when we had these changes in the law, essentially providing guidelines or regulations for teleworking and what companies have to do, essentially paying for internet and energy bills and those things if people were working mostly from home. So we want to measure the impact of that, or also to see something that we have probably in many countries has happened, that we know that more women are working from home, and that is creating again more work because you have to combine the unpaid and paid work at the same time. So we want to measure the impact of that. But at the same time, also study, we have seen a lot of increase on studying from home, different hours, different times. So this was a request that it was really popular in different groups in meetings that we have. So to include the option of having only virtually or essentially from home, or the hybrid options. to study, and that is something that we also included in our test. Regarding pets, a lot of people are asking to include pets not only in this survey but also in the census, in so many surveys. So here we included essentially time that people are spending taking care of pets, but not only just regular care, but also taking them to the vet, walking, and all these activities. And of course, we're trying to keep everything based on the ICATUS classification, so we are in line with all these things. But another important adjustment that we were asked to include was not only going with somebody that is receiving care, but also to make the distinction between just taking somebody to the hospital or waiting with them, spending time with them, but also include the option for emotional care. And this again, we are making this decision just by watching somebody or being there with them, listening to them, and essentially to see what is happening with these activities. And also, again, face-to-face care, like spending time with people or other people living in the household, or people just socializing with people, not only face-to-face, but also spending time with FaceTime, with family, relatives. So we're trying to see if that would be something that has an impact on the quality of the information that we are getting, or that we can get more information on that. So in general, when we contrast the ENU 2019 and the new questionnaire that we have, we ended up with 12 additional questions, which is something that we thought that it was in the it would not affect the time that we're spending on the survey in a significant way. So most of the new questions were, again, in the social demographic characteristics of the household, but also some of the dwelling characteristics, having internet, having streaming platforms, or something related to that. And as I was saying, in last year, between November and December, we conducted this test. Essentially, we went to the field with 5,000 households that we visited for each of the questionnaires that we had. We collected information. This is only representative of the national level, but what we are doing is having these 5,000 questionnaires of each. We were really careful to in the states that we have the offices, they are not allowed to share a space. Essentially, we keep these two teams independently. So we are confident that they are not sharing information. So we send them to the field and to collect the information. And we finished this in December. So now we are in the process of analyzing the results and to see if we have significant impacts on the inclusion of new questions, of changing the wording or changing the options that we have. Sometimes we want to see these changes in the information that we're collecting. Sometimes we are not expecting to see these things. So after we are done with analyzing this, we have to present this information to the governing board at INEGI. And once we get the green light, then we can go ahead and have the final questionnaire for ENU 2024. And I think that's it. Thank you.